Cárdenas, you're recognized for 5 minutes.
Thank you very much, Madam Chairwoman. Appreciate this Oversight Investigation Subcommittee leadership for allowing me to wave on to this hearing, which could not be more urgent. And thank you to the witnesses for joining us today. I want to take a moment to tell a story of Leji Dua, a California storyteller with We Testify. Despite being on birth control, Leji Dua learned she was pregnant when she went to see her doctor for her annual wellness exam. Just 2 days earlier, Leji Dua had received a deportation letter threatening to deport her from the United States. She didn't have a job or health insurance, and she was uncomfortable with the idea of sharing the news of her pregnancy with her husband. She was 10 weeks pregnant, having just received news that her residency in the US was increasingly uncertain, so she decided to get a medication abortion. While she found it painful, she also felt safer in her own home. Despite all of the emotions, never once did she feel conflicted on her decision. She has no regret about deciding to have an abortion. Leji Dua was able to access an abortion on her own terms, something that the Dobbs decision now threatens for every woman in our country. Dr. Verma, I'd like to focus in particular on the disproportionate impacts that the Dobbs decision will have on communities of color and poor women in the United States. We know that those already facing barriers to accessing abortion will face additional challenges in the post-Dobbs world. In your testimony, you state that, quote, bans and restrictions on abortion care have far-reaching consequences, both deepening existing inequities and worsening health outcomes.
Thank you for that question and for sharing that story. So yes, we know that bans disproportionately affect those from already marginalized groups. And I also want to be very clear that pregnancy and childbirth can be incredibly dangerous and are particularly dangerous for people of color. So data from the CDC shows that Black women face 3 times higher maternal mortality rates than their Black counterparts. So again, there are so many reasons why it is important for all of our patients, including our patients of color, our patients with lower financial means, our immigrant patients, adolescent patients, to receive the care that they need.
So basically the post-Dobbs world is going to affect some women more than others in America. And it appears that by default, if you're middle class, upper middle class, you're not going to be affected anywhere similar to somebody who is white or of color who is of lesser means.
I feel that all people will be affected, but I do think that those that aren't able to travel to get the care they need, that aren't able to put the resources together for the child care, taking time off work, getting a ride, the people that aren't able to do that, we are going to see not being able to get care to larger extents.
So we're looking at an unequal situation.
Absolutely, and this has long been the case, that the people with means, people that are able to travel, have been able to get the care they need, and people that aren't able to do those things haven't. We've been seeing these disparities, and I think they're only going to get worse.
Thank you. Ms. Bracy Sherman, because you work so closely with Black and brown communities, can you tell us how racial disparities in abortion access will be worsened by the Dobbs decision?
Absolutely. Thank you so much for that question. So because of lack of access to healthcare and financial means in this country, Black and brown people have a disproportionate ability to access healthcare overall, but particularly when it comes to contraception and abortion care, and also maternal health outcomes, right? Trying to get prenatal care, trying to actually have checkups regularly is really, really difficult. So that means that people aren't able to spend $1,000 to afford an IUD, for example, as birth control. I myself could not afford birth control because at the time there was a copay. So it was $120 every time I tried to get my birth control, which is why I ended up needing an abortion. We know that Black and brown communities are underinsured, really have a lot of difficult times trying to access healthcare. So it's important that they have full access to the spectrum of healthcare, and that absolutely includes abortion.
Thank you for your expertise, and I yield back the balance of my time.
Thank you. Continuing in seniority on the full committee, Ms. Dingle, you're now recognized for 5 minutes.